Excellent. Good to go.
So it was the 2nd of September 2021. I received a phone call from a police officer who said that our dad had collapsed, had been found by a member of the public and had collapsed in a car park, and he had been rushed into hospital. His oxygen levels were low, and therefore he was taken to A&E, and they were doing his obs. And at that point, I said, "Oh, is Dad there with you? Can I speak to him?" He said, yeah, sure. So he passed me over the phone, and I said, "Oh, Dad, what happened?" And he said, "Oh, I just felt really, really weak. I needed to just get back to the car, have a drink, and just sit down. And then my legs just went." And then he passed the phone back to the officer, and the officer said, "Oh, his obs have sort of returned to normal, so you're going to need to collect him." So I was like, "Yep, sure, that's absolutely fine." So I said to my dad, I'll come and get you and come back and stay with me or Kel. Obviously rang Kel and told her what happened, and then shortly after received another call from a doctor who said, "We're keeping your dad in overnight. We think he's got COVID." And it just kind of spiralled from there, really, didn't it?
Yeah, when he rang, he actually said your dad's got COVID and he's going to ICU, and he's not in a very good position. But I think it was about 15-20 minutes prior to that you spoke to the hospital, and they said, you can come and pick Dad up. So it was a very short window of time from he's fine to, oh, he's got COVID and he's got to go to the ICU ward.
Yeah, it was a bit of a shock, really, wasn't it? So yeah, like I say, it just spiralled from there. He went up to COVID ICU. At that point, they didn't have a test. He didn't have a temperature. He didn't have a cough. So he wasn't really showing any signs. And I said to the doctor, I said, "Look, do you know that he's diabetic?" Because leading up to this, he'd ring us and say he was having these episodes of feeling like really weak and needing to like rest. We saw it ourselves, didn't we, when he used to come and visit us?
A couple of weeks before it actually happened, he came over the last time we saw him, and he was at my house, and he'd had dinner, but then all of a sudden he was kind of like shaking, and he said, "I need something to eat now." So I could tell he was having another one of his episodes where his glucose levels went right. So we could see there was obviously something wrong, and then obviously I guess that's what kind of happened in the end. He collapsed, and
yeah, that was our kind of what we thought had happened. It wasn't, COVID wasn't really on the agenda. But the doctor just said, "Oh, no, he hasn't got COVID." I think Dad had possibly not spoken to the doctor about it because he was embarrassed. He was a very private man. He was scared of the hospitals or doctors, and he knew that he wasn't doing perhaps what he should have been doing in order to look after himself. So he got put onto a COVID ICU ward. We was told that he didn't have a phone, so there was no means to contact him directly. So I purchased a phone and we ran it up to him and tried to speak to him on the phone as often as possible, but he didn't always have it. He seemed okay at first. He was going to the toilet himself, he was eating and drinking, and then he's sort of day 2, like the panic sort of started to set in, and he was ringing us in complete distress saying, "I need to get out of here, I don't know what's going on, am I going to die in here?" Which for us was really, really difficult, because as a family member you feel like you're supposed to be there, one, to support your loved one, and also so that you can kind of keep an eye on what's going on and question things, and we just couldn't do that. We were solely relying on ringing them and them telling us. That was that. And then so he went in on the 2nd, didn't he? And then I think it was on the 8th I got a phone call from a doctor saying, your dad's really panicked, please can you just ring him and just try and get him to calm down. So I called him, he didn't answer, and then literally off of the back of that, it must have been within minutes, a doctor rang me, Dr. Raja, and said, your dad needs to go on a ventilator, he needs to go on it now, otherwise he's going to die. And I was like, I don't feel comfortable with this. I said, because I've literally just spoken to someone who's asked me to get me to calm him down, and now you're saying to me, is this or this kind of thing? Like, I need to speak to my sister. He was like, no, you need to make a decision here and now because your dad is going to die. So I felt really backed into a corner, and so that is what happened. So then he was on a ventilator for a few days. They were pruning him.
He was actually doing well, wasn't he?
Yeah, he started to show real signs of improvement. We were ringing up, talking over the phone so he could hear us, like we'd get them to put the phone to his ear.
Because I think when they put him on his back, his oxygen levels weren't doing so well, were they? But then it got to a point where when they were putting him on his back, they were actually stabilising.
Yeah, that's right.
So it felt like we was making some sort of progress, which was great.
Yeah.
And then that's when it kind of all went downhill, because they made a decision that they wanted to transfer him to Bedford Hospital, which we weren't very happy with, were we? Because they said that he was a Bedford, because he's from Bedford, he's a Bedford patient and he needs to be moved. That was the reason. And we was like, but he's doing really well, we don't want it to compromise his position. But also, in all of that, they did keep saying to us, oh, your dad's critically ill, didn't they? And
they kept saying he's an old man, he's old, he's really not well. You know, they were just kind of preempting, I feel like, what he was going to, what was going to happen kind of thing. And also sort of backtracking a bit, from the beginning it was, he's 64 years old, he's unvaccinated, he lives on his own, he's not got any family, so it just kind of felt like he was the perfect, I don't know what the word is that I'm looking for.
Victim?
Yeah. And I feel like they used that.
They drew a picture of him like he was a vulnerable man because he had no family.
An easy target is what I'm looking for. Definitely.
Yeah.
So they said that they would need to transfer him, which obviously we were really, really unhappy about, especially because in the last day he'd made so much progress. Like, he was needing sort of 80% oxygen and it reduced down to 40. So that was like a huge difference, which is why they said, oh, well, he's the most wellest patient in here, so it's only right we transfer him.
And it's like, well, if you need the bed
now,
then right now, can't you transfer that person to Bedford? Like, why does it have to be our dad? Like, we're really not happy about that decision. And they basically said that decision is out of your hands. That's for us to decide where that patient goes. So we had no choice. We both made it really clear that we wanted to know exactly when he arrived and that he got there okay, and what and his status of how he was feeling and how he was doing. Which didn't happen when he got to Bedford, did it?
Not straight away. It took some time. And I believe you spoke to them first, didn't you?
Yeah. So I wasn't very happy. I spoke to the doctor at Bedford, and I said, someone was supposed to call to say why, that he'd got there okay. And she said, I'm really sorry. We've literally had to spend all morning with your father. We've had to adjust his oxygen settings. We've had to change the type of machine he's using. We've had to change his medication. So we've had to spend a lot of time with your father because basically he came in a bit of a state. And she said he's not in a very good way. It's not looking good.
Yeah, so I think that was on the 12th, the 13th, I think, possibly. And so obviously they continued with his treatment, they continued pruning him. And it just nothing was really improving. If anything, he was deteriorating, I'd say. And then on the 16th, we got the call to say, basically, there's no more we can do. And we then got invited in to say goodbye to our dad, which I suppose it's a bit of a kick in the teeth. It's like, you know, why couldn't we have been there when he was present, not when, you know, he was dying.
And something that we didn't mention actually was what came to us as a bit of a surprise when he got to Bedford Hospital was that Luton and Dunstable had put a DNR in place for Dad, which we was unaware of, but apparently we'd agreed to that, or Lisa had agreed to that, which wasn't the case. So that was a bit of a surprise to us. Did
you find any documentation with the DNR on?
Yeah, we so after Dad had passed, we asked for documentation from Bedford Hospital and Luton and Dunstable, and I found the DNR, and it basically said that I had consented to a DNR that was actually signed on the day that they put him on the ventilation machine, which was on the 8th. We knew nothing of it until Bedford had just happened to slip it into conversation not long before he died. So it was just a complete shock, wasn't it, really? It was almost like, so you'd already made the decision for him. You knew exactly what was going to happen. But what made it worse was obviously we then, you know, went through all of the medical notes.
That's when everything kind of unfolded to us, that actually there was more to the story. I mean, we kind of knew that there was something not right anyway, and we
always felt it from the very beginning that something just didn't add up.
And actually, when we went in to see Dad, and the doctor at Bedford Hospital, we spoke to him and he took us into a room, didn't he? I kind of had this feeling that the doctor was also kind of aware of what had happened to Dad at Luton and Dunstable Hospital, and he was kind of, I don't know, I just got this feeling from him that he knew that what was done was wrong, basically.
And sort of advised to take it up with Luton and Dunstable as well. If we had a complaint. So when we got the medical notes and we went through all of it, we could clearly see that he obviously had blood tests when he went into A&E. He had exceptionally high glucose levels. I think it was like 29.
It was kind of,
but also he had a high level of ketones in his body, which is seriously dangerous. Basically means you can go into something called ketoacidosis, and it can result in you collapsing and going into a coma. So in my eyes, that's what happened. The treatment that they gave him for COVID actually exasperated whatever else was going on, and that's clearly written in the medical notes.
From the diabetes nurse.
When the diabetic nurse eventually got round to him, which was like probably 5 days in.
But we did express every time we spoke to the nurses and the doctors that we believe that Dad's collapsed because he has an issue with his diabetes. The nurse that actually saw him, the diabetes specialist, said he was newly diagnosed. But we know that this had been going on for a lot longer, but they didn't listen to us. They just kept pushing, oh, he's got COVID, he needs to go to COVID ICU.
It's like they just made their mind up and that was it.
They weren't interested in the fact that
we knew him, we knew what was going on.
And that he had an issue with his diabetes. But yeah, anyway, so we decided that we wanted to look at the medical notes, and that's when we kind of realised that when he went onto the COVID ICU ward, that he didn't actually have COVID. He didn't have a COVID positive test till 4 days later, was it? So that was the first thing. And then we established, well, we knew about the DNR, but the documentation was in there, and it actually did say that we'd agreed it. And then we found out that, what date was it, Lisa? Was it the day before he got moved to Bedford?
Yeah, so it was the day before. So they were discussing with us the day before that they wanted to do the transfer. And it was actually that day that they decided to take him off of, I think it was propofol and fentanyl, which he'd been on the whole time as his sedation drugs, and they actually changed it to midazolam and morphine. So this was prior to them deciding. Well, they already decided they was going to transfer him, but during that time they switched his medication, his sedation medication, to that, and it was at 5 milligrams. When he went for the transfer, they reduced it to 2.5, but they also maximised the ventilation oxygen to 100%, so he went from 40 to 100.
Which, yeah.
And so then when he got to Bedford Hospital, that's why it took them so long, because they were like, what's going on here, to adjust everything. And they took him off midazolam and morphine straight away and put him back on what he was previously on before they'd done that. So
Newton and Dunstable also reduced the midazolam and morphine milligram to 2.5 before they moved him.
Yeah, for the transfer, yeah. So to me, that was very suspect. It's like they never used the words Bedford Hospital that this was what he was on, but they said they couldn't work out what had happened and why he was on that level of oxygen for the transfer, and the medication that he was on wasn't correct, and therefore they had to change it, and it took them ages to adjust it all. So for us, that, as you know, obviously we know that that's used as like an end of life drug. You know, he was already struggling and on ventilation, so then why would you switch that drug, especially if you're telling us he's the wellest patient and therefore we can transfer him, he's doing the best. Why would you do that? Why would you do that? It was almost like they sent him off to die. And I believe that that's what finished him. I really do.
Yeah, 100%. Yeah,
I think, you know, things could have been very different from the beginning anyway, but without all of the other stuff. But yeah, that was the final nail.
He's card marked from the beginning. I think they knew what they wanted to do.
Why would they do that?
I believe that during the COVID period, it was to inflate numbers. I believe that they thought he was a 64-year-old man and he was an easy target. That's basically it. Not just because he was 64, but with all the other things as well. I think age is a big factor, but I think the fact that he lives on his own, he's unvaccinated. At one point, I did actually, because me and Dad had a conversation on the phone, and he said I should have got the jab, Lee, so I should have got the jab, and I said I don't believe that's entirely true. And then I kind of felt a level of guilt because I just kept saying to him, just hold off, just wait, let's just wait and see what it does, because nobody really knows. And then off the back of that conversation, I then spoke to the nurse in charge and said, can you tell me how many people on this ward are vaccinated and unvaccinated? You know, is it more? And she said, not really, it's really mixed. And I said, do you think that the vaccination would have made a difference? And she went, so, you know, because like I say, I felt a level of guilt. And, you know, I wanted to tell my dad that, you know, you're not here because you're not vaccinated. I don't believe that at all.
I think they made him feel so scared. A couple of times when I'd spoken to him, one being the day before they put him on the ventilator, he rang me up. It was my little boy's birthday, and I was out with my little boy at the time, and he rang me up and said, you've got to get me out of here, Kelly. He said, I don't care if you have to bring the kids. He said, get me out of here. He said, I can't stay in here. He said, just do what you need to do. And then I think he knew what was happening to him. I think he was so scared, so scared.
You just kind of feel like as well, like in that moment where I'd got, you know, a doctor ringing me up saying, bring your dad, you need to calm him down. And then a doctor ringing you say, oh no, you need to make a decision, he needs to go on ventilation. I just feel like, what was going on in that room at that moment? Like, did Dad know what was going on?
He knew.
And we have to live with that. We have to live with that every single day for the rest of our lives.
So you got to the hospital in time on the day he died, so you were with him when he died. What happened when you got there? How were the staff with you?
We got put into a side room, didn't we, and spoke to the consultant who was in charge that day, and they just sort of talked us through, you know, what was going to happen. He was at that point on his stomach, wasn't he? I think we got to spend an hour with him as well, didn't we? We got to spend an hour with him before they were going to turn him over on his back, because they basically said that when they turn him over his back, he's going to die. And then they just gradually just removed
we had to
all
go
machinery,
in, didn't we, all kitted
medicine,
up, with all the, you know, masks and suits and.
We took a break as well, didn't we? Before they moved him, before they turned him onto his back, they said go and take a break. You know, go and get some fresh air, get a coffee, whatever. So we did that. But when we returned, the head nurse said to us, "Oh, you do realise that you're going to have to isolate now for 10 days?" And I'm just like, are you having a laugh?
So we're not allowed to see any of our family. We've just lost our dad and we've got to isolate.
Are you doing that? Are you isolating yourself 10 days every time you leave this ward? Like, it's just complete nonsense.
And actually, we had just been to see Dad before they turned him over, and we went to take a break, but we were allowed to leave the hospital grounds, which we did. Obviously, we could have potentially...
There was no question.
Yeah, it was fine. We could have potentially infected somebody. But then once, obviously, they'd switched the machines off, we had to then isolate for 10 days.
Which we didn't. There was no way we was doing that. We was told as well that we weren't really supposed to kiss him, I don't think. Was we told that?
Yeah.
We wasn't we? Well, we did it anyway. I just thought, this is our last moment with our dad. Like, you're not taking that away from us.
So they actually told you that when they turned him on his back, that would contribute.
His heart rate would slow down, yeah.
So they would do that on purpose, to turn him on his back, to slow down his heart rate.
Do you know, I've never thought
of that, to be honest.
I think we just accepted that this was it. Like, he wasn't.
At that point, what medication was he on at that point?
He was on the fentanyl and the propofol, is that how you say it?
He was. He was on obviously pain relief and antibiotics. I can't list them off the top of my head. There's just so much of it. That's the thing.
And you said they then they took him off the ventilator.
Yeah, they withdrew all the medication. They stopped the ventilator, and then obviously he died, and that was it.
What do you think killed him?
I feel like the ventilator obviously is, you know, it's really bad for your lungs. He'd been on it for days and days and days. I think the midazolam and morphine was a massive factor, because I feel like even with the ventilator, before they transferred him, he was showing huge signs of improvement. And it just kind of felt like when they then gave him that drug, or them drugs combined, and then obviously increased his ventilation, it just completely compromised his whole position. And I just feel like it was game over then. I just felt it was just the machines that was keeping him alive. I felt like he was already gone.
Yeah, when we went to see him, it was like he wasn't there anyway. And he was a state, weren't he, Lise? He was bruised, he was swollen, his lips were swollen, just didn't look like Dad, did he? He just looked like he'd been through hell and back. He's just...
And the thing is, a really strange thing is, I suppose anyone could say this, I always thought he'd be around for a really long time, because he just didn't strike us as an elderly or unwell. I mean, he wasn't elderly. I don't consider 64 like an elderly person. Christ, no. But like, it was just such, the whole thing was just such a shock. It's like we went from come and collect your dad at the hospital to he's dead in an ICU ward of COVID. It just...
And was COVID on the death certificate?
Yeah, we did try and challenge it, didn't we? COVID was the primary cause.
An underlying
and then
cause
was hypertension and diabetes.
And they actually they gave us the death certificate, which during the COVID times they stopped doing. It would be sent automatically, and even though they asked us to isolate for the 10 days, they demanded that we bring it back. So we had to go back to the hospital and bring it back. They didn't want us to have a copy of the death certificate.
I actually
I'll restart there just to...
Yeah, I actually obviously we put together a complaint. We worked on it for a whole year, didn't we? And I also contacted the officer that actually was there at the scene when my dad collapsed, and he went to the hospital with him. And I just said, "Oh, I just wanted to ask you some questions." And he was like, "Yeah, sure. How's your dad?" And I was like, "He's dead." And he was like, "You're joking. What happened?" I said, "Well, I beg to differ, but he got put on a COVID ICU ward, and that's what he died of." I said, "Did anyone contact you to let you know that he had COVID, that you was in contact with somebody that had COVID, you know, to see so you could isolate?" He was like, "No, not at all." He was just in complete disarray and shock that was the outcome of that whole scenario. But yeah, so we put a complaint together. We had a meeting, didn't we, with Luton and Dunstable. We sent the complaint to Bedford as well. We wanted someone from Bedford to represent themselves as well, because we had questions to ask them. They never got back to us. Yeah, so we were saying about we put this complaint together, and with NHS PALS, we sent the complaint to Bedford PALS and Luton and Dunstable. Bedford never actually, they never got back to us, and I emailed them. They just never even acknowledged any of it. It was only Luton and Dunstable. So when a meeting was set up with Dr. Raja, because we kind of felt like he was the one that made a lot of the key decisions regarding Dad and all the key points in his hospital stay, and we had the hospital manager, I can't remember his name. Chris, yeah. Chris. And we specifically asked for somebody from Bedford to be present at the meeting, because, you know, obviously they had their version of events and we felt like they needed to be there. I
think especially the fact that they'd switched everything when
because they felt that they needed to do something different. Like, why was that? But Luton and Dunstable said that they will speak on behalf of Bedford, which we felt was a complete conflict of interest, because it's like, you're not them. Okay, you're all part of the same trust, but it's a different hospital. But it just was a big no-no. We had questions, didn't we? A lot of questions for the doctor. I kind of felt like he was spitting feathers, to be honest with you. I felt like he was nervous, he was agitated. And I remember saying to him, why did you feel it was appropriate to change his sedation medication from fentanyl and propofol to midazolam and morphine? And he said, well, you know, it was COVID protocol. And I was like, but why at that point? And he said, well, sometimes it can be because, you know, if we're running out of other medications. And I said, but the thing is, I said, he had a so-called respiratory problem, and you put him on drugs that suppress his respiratory. Why would you do that? And he turned around and he said, well, he was on a ventilator anyway.
And even the lady from Pals was a bit like afterwards, like... What?
I don't understand the answer to that question. That makes absolutely no sense. He's in there so you can make him better, get better.
Were you aware of the protocols at the time, like the NG163?
Yeah, to be honest with you, my heart completely sank as soon as they used the word COVID and IC, because I knew straight away what that would entail. And then I kind of think to myself, like, why didn't we do more?
Yeah,
like, why did we allow that to happen?
When we kind of knew all of this. Like, why did we put our trust in them? But you do, don't you? You do put your trust in.
And then you're kind of torn between, like, no, it can't, like, this can't be, to actually, it is what it is what I believe. And, you know, I know people that have worked on these wards, and they say things like, you go in there, you don't come out again. You know, it is a death sentence. So, you know, whatever that protocol is, it's not making you better, it's making you worse, and it's making you, well, you're going to end up dead, basically.
And you believe that your dad knew, do you think he knew that he was being put on this sort of pathway to death? Do you think he really...
I think he did.
I think that's why he was so scared. That's why he rang up saying, get me out of here now. You know, and I feel guilty because I was like, Dad, just calm down, you know, you need to listen, like, they're there to look after you. So there's a level of guilt from my side because I'm like, well, I should have listened to my dad. Why did I let them do that to him?
You kind of think, like, what were they saying to him? You know, why was he so agitated? You know, because to start with, he was okay. He was managing, and then it just seemed to spiral, didn't it? It was like, what are you saying to our dad to make him, like, just panic so much?
I just thought at first, because Dad didn't like hospitals or doctors, like, he wouldn't go to the doctors, or he was always, like, kind of scared of that side of things. So I just thought, oh, it's Dad just being a bit... But actually now I realise that there's so much more to the story, and I wasn't aware of that at the time.
It's made us lose complete faith in the NHS and hospitals. You know, recently our mum had to go into hospital just before Christmas last year with some type of flu, and it just literally, it's like post-traumatic stress, like, the whole time.
You want to do COVID tests and you're like, no, because you're scared that she's going to follow the same protocol.
Well, it is still happening.
Exactly.
I spoke to someone last week whose mum's just been killed in hospital, so they're still doing it. It did seem to be a lot more prevalent in, like, 2021, but it is still happening.
I guess it probably depends on the hospital or whatever, but, like, we spoke to, because they kept pushing for this COVID test, and we was like, you know, what's the protocol then? Because they were saying things like, well, because you won't have a COVID test, you're putting vulnerable people at risk, so we're going to stick you in a side room. And then we was like, well, what's the protocol now? And they said, well, there isn't one. So, sorry, we're kind of going off track a little bit here.
No, you're doing really, really well, actually. covered everything in a short space of time.
Yeah.
Have you got any other questions?
No, I think that's about it from me.
I think it's
is there
right.
anything else you think? Okay, well.
I think you've covered everything from what
I think, yeah.
I think so. I think that's it's kind of
Pretty
everything.
much, isn't it?
Excellent.